So it's Friday the 16th of October, and here we are at Twycross Zoo for the Prime Minister's Commission on about nursing, and we're catching up with loads of young people here. Very, very busy. All the older groups walking around the zoo at the moment, and we've got all the young people working in small groups, and we're catching up with Liz. Hi Liz, how are you?
Hi, I'm good, thanks.
So what do you think about this?
I think it's just wonderful. The children are really engaged. I mean, I think it's very difficult for them because what they'd really like to do, I think, is go out and see the animals, but they are really working quite hard.
Now, you were one of the three people up on the stage at the very beginning when Holly introduced it, and you were saying that you're actually all nurses, so you're really interested in finding out what the young people say.
Yes, that's absolutely right. My predominating background is in the care of children, so all my clinical experience is in the care of children, and I'm one of the people that sits on the commission, the Prime Minister's Commission, and it was very clear that when we were going out to meet with the public and with other nurses, we had actually missed a group, and that was the children and young people. So it was our suggestion that we should do a special event for children and young people because it is their future. It will be them that will be the future doctors, nurses, healthcare professionals, but also they are the patients of the future, so we've got to get it right for them.
Because it was interesting because one of your colleagues said put your hands up those that have ever met a nurse or experienced nurse, and quite a few of them had.
Very high proportion. And what's been very interesting actually on this table here is that a lot of them, of course, have met a nurse in their GP surgery and also at school. They're very fixed on injections. I'm not quite sure why. And another little girl has just said she doesn't want to be a nurse because she's going to have to wash her hands too many times. So that for me is a very interesting message that she's picked up about how important it is to keep infection risk down.
And this is the first time, I believe, that young people have actually been consulted in this way, is that correct?
Well, I think young people have been consulted in health, but not quite in this way, with young people actually running the day. And that's the big difference. So, and they're managing it, they're controlling it, they've decided what activities to do. They've talked to us a bit about what we wanted out of it and why we were doing it, but they've designed the whole thing.
And it's great that the Prime Minister has put this commission together, isn't it, really, to kind of look at the future and the shape of things?
It is, because we need to respond to public concern about the image of nursing. We need to respond to the fact that actually things have changed a lot over recent years, and we're living in very turbulent times, and we've got to look at the best way of managing our resources and actually getting the best out of the staff that we've got to work for the best for patients. So yeah, it's a very timely piece of work.
Brilliant. Well, thank you very much for taking the time to talk to us. Enjoy the rest of the day.
Thanks.